Dear students, welcome back. In this session, we are going to discuss about lateral compartment of the leg, which consists of muscles mainly, and also the superficial fascia, deep fascia. Okay, so in this session, we are mainly discussing about the muscles of the lateral compartment of the leg. Before that, the lateral compartment of leg, otherwise called the aorta, fibular or peroneal compartment, which is the narrowest of the leg compartments. It is located in the area bounded by anterior intermuscular septum. So here this one is the anterior intermuscular septum, and the lateral surface of the fibula. This is the lateral surface of the fibula, and the posterior intermuscular septum. So this forms the lateral compartment of the leg. Okay, so now we will see the muscles of the lateral compartment of the leg. So in this compartment, it consists of mainly two muscles. One is Peroneus longus and Peroneus brevis. Okay, so this one is also called as Fibularis longus and Fibularis brevis. If you see the origin and insertion for this Peroneus longus, so this Peroneus longus is originating from the head of the fibula and the lateral surface of the fibula, upper two-thirds of lateral surface of the fibula. Okay, if you see the insertion, the tendon passes behind the lateral malleolus and across the lateral surface of the calcaneum, and then it rounds the cuboid bone and it enter into the sole. Here you can see it enter into the sole here, and it runs medially across the sole. Here it is running medially across the sole, and the tendon is attached to first metatarsal bone. Okay, that to lateral side of the base, of the first metatarsal bone, and also lateral side of the medial cuneiform bone. So this is the insertion. What is the action means here? Eversion of foot, and it is also maintains the arches of foot, and it steadies the leg on the foot, especially while standing on one foot. Okay, and this muscle is supplied by superficial peroneal nerve with root values L5, S1, S2, and this superficial peroneal nerve is the branch of common peroneal nerve. Now we'll move on to the another muscle, that is Peroneus brevis. Peroneus brevis is originating from the shaft of the fibula, that to lower two-thirds of the lateral surface. The tendon passes behind the lateral malleolus, which is lying anterior to that of Peroneus longus, run forward on lateral side of the calcaneum. The tendon is getting inserted into the fifth metatarsal bone, that is lateral side of the base of the metatarsal bone. So this is the insertion. Okay, and if you see the action, this is also helps in eversion of foot, and which also steadies the leg on the foot. This one is also supplied by the superficial peroneal nerve. So this compartment is also called as aorta compartment. So this Peroneus longus and brevis are the powerful aortas of the foot. Thank you.